26 million Americans have asthma as one of them, and somebody with a few friends who also have it. I can tell you, not all asthma is the same. Up to 10% of patients have severe asthma. Emerging science is now helping doctors better understand it, which of course affects management. Donna Matlach has severe asthma. Dr. Mark Forshag is a pulmonologist with GlaxoSmithKline. Both join us now. Good morning.
Good morning, Mary.
Doctor, I'd like to start with a definition. What is severe asthma, and how is it different from regular asthma?
So when most of us think about someone we know who has asthma, we think of someone who's young, who uses their rescue inhaler a couple times a month, but otherwise lives a perfectly normal life. Severe asthmatic patients, in the absence of therapy, have symptoms virtually every day. And the technical definition would be someone who requires 2 controller medications, usually at high dose, to maintain control, or may not even have control on 2 high dose controllers. We're learning more and more that severe asthma is made up of several subtypes, and the best therapy for one may not be the best therapy for all.
Donna, for you, what was the first sign that you thought there was a chance you'd have and be diagnosed with severe asthma? What were you noticing?
Well, as Dr. Forshag said, I was one of those patients using just an inhaler and some corticosteroids, but the prescribed medications were no longer working and my symptoms were worsening to a point where I was debilitated and homebound. So there was no doubt that, I had something more than just asthma.
Right, like for me, for example, I'm the 90%, right? It's stress or it's exercise, you kind of know how to control it, but boy, you were in a pickle there. Doctor,
Yes.
Are there some commonalities that you notice, people who get severe asthma?
So most commonly it's people who have onset in middle age rather than the youth onset that we think about. And it also tends to be less allergic than milder forms of asthma. So it's a middle-aged person, more commonly a woman than a man, and it comes on relatively abruptly, and then it ramps up in severity over a relatively short period of time, perhaps 1 or 2 years.
Donna, once you realized you have severe asthma, what did you do? What kind of treatment, what course did you take?
I immediately took action. I researched, I became my own advocate. I constantly was in communication with my physician and my specialists. Anytime I had an exacerbation, they knew about it. The slightest change in any of my symptoms. I had to be my own best advocate and watch and try to control my severe disease.
Yeah, I think that's such an important point and a good place to leave this conversation. Give us one website and then we'll let you both go in case our viewers want to learn more about the science and treatment of severe asthma.
So your doctor is the best source, but an online resource that's very helpful is asthma.com, ASTHMA.com.
Some intriguing research happening here. Dr. Forshag, Donna, thank you for joining us.
Thank you.
Thank you for having us, Mary.